Hi everybody, it's Crystal Cox, and I am talking about the Bootcamp Integrated Healthcare discussion. And some of my takeaways, may be a little minute, but I thought they were really neat. And to be able to take it further into my professional practice eventually, I would like to be able to be more effective and efficient and organized like this integrated healthcare system is. I know it was very informative and interesting, and it seems like at that center that they have a very efficient way to run their health center with their patients. I think one of the things is the medical record piece of it, that it red flags the patients for whatever reason, and it only gives access to certain people. I do think it's very advantageous to be able to have all the doctors and the mental health providers and certain ones to have the rights of the shared records. I think that's very important and vital because you're able to see pieces of a puzzle put together, not just isolated here and isolated there. You're able to see it on the screen and hopefully be able to put those puzzle pieces together to be able to have a more informed decision or a diagnosis of a client or a patient. Another takeaway that I have is there were many acronyms and symbols for different types of things. I know I jokingly said CA was California, and cancer is what it was. But those things, while they are minute, to be able to have the acronyms, that is a very time-consuming job. I think with the paperwork part of it, I think it's a lot of red tape, but I know it's necessary. So I do believe, for time's sake, to have those acronyms to be able to spread across, this is what this is what this is, and we all know that's, this is what they stand for. I think that's very important because time is of the essence sometimes, and I relate it back to, like a waitress at a very busy restaurant. She doesn't have time to take down the whole entire, sentence of the order. She has to do her shorthand. And if a healthcare center can have the same acronyms, it does cut down on time to be able to do some paperwork and to quickly go in and out of a patient's room. Future practice, I think that, in my mind, I think there are certain things that I would like to have shorthanded, and just to be able to have accurate records, to be able to make sure they stood across the board for everything. I thought that was a good takeaway. Another takeaway that I thought was important was the primary care physicians, how they felt ill-equipped to give diagnoses or give medication out to patients, when it said that the percentage for the patients, it said 7 out of 10 patients needed or had a related need to an underlying psychosocial concern. I think with primary care physicians that, they do care. I give them credit for the time constraints that they have. But it said that they felt, 2/3, I think, felt ill-equipped to give the medicine and just not ready to do that, but they did it. And so I think in an integrated healthcare system, with behavioral health being on call, and that was another takeaway, was having those on-call people to be able to have them, jump in those rooms and be able to talk and get a snapshot of those clients and to be able to diagnose or take those next steps are very crucial. I think on one hand, the negative part would be coming in saying, I trust my primary care physician. But as a client, I don't really know that primary care physician might be one of those 2/3 of those that feel ill-equipped to give it. So with the mental health provider there on call, that person can go in and back up what that primary care physician, is feeling ill-equipped to do, or to reassure, saying, you're doing these signs and symptoms and you're doing a good job, or maybe this is what we could do because this is my specialty. So I think more teamwork, more collaboration, I think that's always a good thing. I also want to be able to take that into my future outlook for behavioral health care and counseling, is to be able to collaborate with a team of people and be able to see the whole patient like the integrated health care does. Overall, a wealth of knowledge, very educational, very interesting. I would love to be able to go see one of these just in person to be able to see how it runs. I think the more efficient, the more, not efficient, but the more effective, organized that you can be with integrated health care like it is, where everyone has the shared access records to be able to see the whole patient. The patient's there being seen for something, but there's, red flags and mental health providers on call there to be paged to go in. I think it is best for the patient. I think you can get better accuracy with diagnoses and just to be able to function overall better in the healthcare world as far as behavioral health is concerned and the integrated care.